In this video, we will answer the question, can chronic pain be healed naturally without steroid medications? The answer is yes. We can resolve most chronic pain by using the platelets in your blood to provoke an immune response to cause natural self-healing. Welcome to the Dr. No Pain channel, where we can fix your pain. Hi, I'm Dr. Thanh Nguyen. I'm a medical doctor board certified in internal medicine, practicing in sunny Phoenix, Arizona. We can fix your pain by using the platelets in your blood to re-inject back at the source of your pain to provoke an immune response to cause natural self-healing. Your treatment will likely have no cost to you if you are in a recent car accident. You should watch this video because we made a groundbreaking discovery in resolving people's pain with a new technique using the newest generation of platelet protocols. We refined this technique in the year 2023 and have injected over 150 patients, and we are extremely excited to report more than 90% have resolved their pain after 1, 2, or 3 injections. So far, the pain resolution appears to be permanent due to natural self-healing. And it appears we can resolve nearly all body parts, including the neck, the lower back, the shoulders, the knees, the elbows, the feet, with our highest success rate being the neck and lower back. I think we are onto something really big here. Let's see if you agree with us after this video. Our philosophy and approach to pain differs significantly from many clinics. We firmly believe that the solution to alleviating your pain lies within your own body's immune system. There's no need for outside medications or chemicals to fix your pain. Therefore, we don't use steroids to inject. Our process begins by recognizing how the body naturally heals any injury. It's about leveraging the power of platelets in your blood to provoke an immune response to cause natural self-healing. Take, for example, when you fall down on the ground, you get a bruise. The bruise is really just bleeding underneath the skin. It's the platelets that stop the bleeding and then send a signal to the immune system to come fix the injury. The same occurs with cuts to the skin, broken bones, or surgery. All those injuries have bleeding, which are stopped by the platelets, which then provoke the immune system to come fix the damage. I hope you see the consistent pattern here. First, there's bleeding that is stopped by the platelets. Second, the platelets send the signal to the immune system. And third, the immune system comes in to fix the injury. We recognize this pattern. That is how we are able to be successful in fixing people's pain, because we provoke the immune response by using platelets to cause natural self-healing. Sounds kind of simple, huh? However, that's not how it's currently being done in today's world of medicine. In fact, the complete opposite of what I just said is currently being done. The focus revolves around reducing inflammation, which we think is the wrong strategy because it unfortunately also blocks the healing process. Medications like steroids and non-steroidal drugs like ibuprofen, naproxen, aspirin temporarily alleviate pain by blocking the immune system, which inadvertently also blocks the natural healing process. What you get is short-term pain relief, but long-term non-healing, leading to the pain coming back. That's not what we want. We don't want just temporary pain relief, but we want long-lasting healing, and we do that by harnessing your body's innate ability to heal itself. Therefore, we avoid steroid injections because they offer temporary relief but prevent natural healing. We do things differently here. Instead of reducing inflammation, we do the opposite and intentionally create a temporary increase in inflammation by provoking the immune response in order to heal the body permanently. And to the best of our knowledge, the best way to do that is to use the platelets in your blood. Why use platelets? Because platelets are plentiful in your blood, and your body makes more of it every day. The best part, platelets are free because you don't have to buy it from a manufacturer. Getting the platelets out of your body is fairly simple. It just requires a simple blood draw out of your arm. Plus, platelets can't cause an allergic reaction because it is from your own body. And we keep the platelets fresh because we re-inject them back into your body within an hour of drawing your blood. These are some of the reasons why we think platelets are better than other regenerative techniques like stem cells, exosomes, or prototherapy. At our clinic, we've achieved a breakthrough discovery in resolving people's pain, which we refined in 2023 using the latest cutting-edge platelet protocol. In 2023 alone, we've treated over 150 patients and more than 90% have experienced pain resolution after just 1, 2, or 3 injections. What's exciting is that the pain relief seems to be long-lasting and likely permanent thanks to the body's ability to heal itself naturally. So, what's the secret to our success? Well, the magic behind our secret sauce lies in our usage of the latest platelet protocol, the third generation known as PRF with albumin gel or platelet-rich fibrin with albumin gel. This was initially published in 2020 and is currently widely used in cosmetic treatments as a natural filler to the face and to revitalize lost collagen in aging facial skin as well as dental procedures. Our innovation and breakthrough discovery as we adapted this cutting-edge third generation platelet protocol specifically for pain relief. Basically, the third generation platelet protocol works better because the platelet signal lasts longer in the body. According to the research paper, it shows that the platelet signal lasts over 14 days, which is much longer compared to the first or second generation protocols that lasted only 3 or 5 days. Based on our own patient population, we've observed that the platelets appear to cause healing for approximately 3 weeks with each injection. We exclusively now use the third generation platelet protocol, PRF with albumin gel, because it just works way better. We no longer use the first generation PRP, platelet-rich plasma, or the second generation PRF, platelet-rich fibrin. In a different video, we will give a more detailed explanation on how the third generation platelet protocol works and why we think it is better than other regenerative solutions like first generation PRP, stem cells, exosomes, and prototherapy. If you find our explanations on how to fix the pain naturally make sense to you and it's thought-provoking, show your support by hitting the thumbs up and subscribe button. Your actions could be a game changer, especially if you share this video with someone you know who has chronic pain and has tried many treatments that didn't work. Maybe our innovative ways can fix their pain naturally. However, after you've watched this video and you think to yourself, yes, I want to use platelets to fix my pain because platelets are better than steroids. Well, that is only half the solution. The other missing half lies in knowing where to inject the platelets. Again, this is another key area that distinguishes our clinic from most other clinics. Because if you inject in the wrong place, it won't work. And that's why the pain improves a little bit, but doesn't go away completely. This makes sense when I say it out loud, doesn't it? But I had to do over 1,000 injections over 3 years to figure this out. Basically, I realized that using the standard injection method was not working because it only led to temporary relief. I was frustrated. I had to inject over and over again. I had to rethink the situation to figure out where is the true source of pain, and once I found the correct site, then bingo! That was what led to resolution of the pain. Many apologies to everyone I injected in the early years of our clinic. I wish I was smarter and had figured out sooner for you. But we think other clinics haven't quite figured this out either. Take, for example, the common practice of using a steroid epidural injection for spine pain. Providers often assume a bulging herniated disc, shown in an MRI, is the primary cause of their pain, leading to a misguided epidural injection inside the spine. However, if you have pure pain and no constant numbness and no constant weakness, then the actual source of pain lies outside the spine, in the facet joints where the spine bends and twists. If a disc herniation inside the spine was large enough to cause a true nerve compression, then this always causes a trifecta of 3 symptoms: pain, numbness, and weakness. These 3 nerve fibers run right next to each other in the spine, making it nearly impossible to affect only one without affecting all 3 at once. This misconception can be easily confirmed with a simple test. Take, for example, the neck pain. The source of neck pain is typically at the middle pivot point of the neck. This is the fulcrum of the neck that allows one to bend forwards and backwards the most. You could locate this point by looking straight up at the sky, which creates a natural crease. When you put pressure on either side of the neck crease and there's pain, this is the source of your pain. What you are really pushing on is the facet joint in the crease. The facet joint is the connection between the 2 vertebral bones that move back and forth. This suggests the pain source is in the bone-to-bone connection on the outside of the spine and not the inside where the disc is located. You can't push directly on the disc herniation to cause pain because there is a bone in the way, namely the facet joint bones. So, when you push on your spine and feel pain, it's probably not from this disc herniation. To further verify if this area is the cause of neck pain, tilt your neck backwards to either the right or left side, then apply downward pressure on the head to compress the spine. If you feel sharp pain during this compression, either on the right or left, this confirms that this is the source of the neck pain. This examination, known as the Sperling's compression test, verifies that the pain is originating from the pivot point facet joint, which is outside the spinal column. So if you have pure neck pain and have no arm numbness and no arm weakness, then a steroid epidural injection targeting the inner spine herniation likely won't work, because that's not where the problem is. We do things differently here and inject on the outside where the real source of pain is. For the lower back pain, the primary source of pain almost always resides at the base of the spine, precisely at the lowest facet joint. The lowest facet joint, L5S1, serves as the pivot point where the spine bends against the pelvis, which does not move. This is the fulcrum of the spine that allows one to bend forwards and backwards the most. To locate this pivot point, look at your backside in a mirror to identify the two dimples at the top of the buttocks. You can confirm this pivot point is the source of your back pain by standing straight up and leaning backwards to either the right or left side, which puts pressure on the facet joint. If there is sharp pain when you lean backwards to one side, this confirms that the lowest facet joint is the source of your back pain. This test is known as Kemp's compression test. If you have pure low back pain and have no leg numbness and no leg weakness, then a steroid epidural injection targeting the inner spine herniation won't work, because that's not where the pain is. We do things differently here and inject on the outside where the real pain source is. Those were just two common sources where we inject differently from most other clinics. We find the source of pain with our fingers. In fact, our philosophy on how to find the source of pain is to literally use our fingers to keep pushing until we find a consistent and singular pinpoint source of pain. While it seems like common sense to use fingers to find the pain, this is not commonly done by most providers. If you have received injections in the past, you may recall that the injection site was likely chosen from an image like an ultrasound or live X-ray fluoroscopy or an MRI scan. And maybe the provider never directly pushed on the pain site. Conversely, we use imaging as only a starting point. Our innovation was to modify the injection technique to use the fingers to keep pushing at the pain sites until one finds the single true source of pain. One of my mentors always said, "Pain never lies, but the image might lie." Treat the patient and don't treat the image, and that's why we get results. In other videos, we will demonstrate how we use our fingers to find the true source of pain. Here are a few patient stories showcasing the positive responses to our platelet injections. This is a 63-year-old man who was a pedestrian hit by a vehicle 30 years ago, resulting in spinal fractures that required metal rods placed in his spine for lumbar fusion and stability. He came to our clinic limping and would not sit down for the exam because it hurt too much. He failed prior epidural steroid injections, and a surgeon did not think a repeat back surgery would fix the pain. However, we were able to completely 100% resolve his back pain after just 2 platelet injections. He regained the ability to do a deep knee bend and a deep squat and even jump without any pain. This example shows that the platelet injection can resolve pain from an injury that's more than 30 years old, as well as resolve pain after a surgery with metal implanted into the spine. This is an 83-year-old lady who has severe scoliosis where her back is curved like an S. Her shoulders and pelvis were tilted, making it impossible for her to stand straight, forcing her to lean on one leg to counterbalance the tilt, and she had to walk with a walker. She had severe back pain for decades on many medications. With 3 platelet injections, we managed to significantly alleviate her back pain. Although complete resolution wasn't achievable due to the scoliosis, she experienced improved functionality and could walk without much pain. This example shows how the platelets can resolve pain even in an advanced age like 83, as well as a chronic condition rather than an injury. This confirms our belief that the body can heal itself at any age and for any condition. If you can heal a cut in the skin, this means that your immune system is working well enough that you should be able to have the ability to heal any pain. This is a 60-year-old man who had a work accident where he stuck his index finger into a garbage disposal 1 year prior. He had severe pain to the tip of his finger. He flinched whenever the finger was lightly touched, indicating he had nerve damage or neuropathy. Normally, there are no treatments available for nerve pain besides prescribing nerve pain medications like gabapentin, which don't work very well. Surprisingly, one plate injection completely 100% resolved his nerve pain. He regained full functionality of his finger without experiencing any pain. This example shows that the platelets can resolve nerve pain, offering hope where no treatment currently exists for neuropathy or nerve damage. If you've been dealing with pain for more than 3 months, there's a very strong possibility we can resolve it. If you're in the Phoenix area, give our clinic a call or text to schedule an evaluation. For those living out of state, send us an email and we will connect you with a medical provider near you trained in our groundbreaking platelet protocol and different injection technique. If we don't know any providers near you, come visit us in Phoenix for a quick fly in and fly out injection on the same day, or a longer stay to explore our fantastic destinations like Scottsdale, Sedona, and the Grand Canyon. Your treatment will likely have no cost to you if you were in a car accident within 2 years, or have a personal injury claim, or a work accident claim. Contact us and we will help you figure this out. Other injuries can be treated with cash payments, as most health insurances does not cover platelet injections with the exception of TRICARE for active military. To summarize, we have accomplished some amazing breakthrough results with our third generation platelet protocol. Over 90% of patients that we have injected have resolved their pain and appears to work in most body parts. We strongly believe that nearly all pain can be resolved by harnessing the power of the platelets in your blood to provoke the immune system to cause natural self-healing. In most cases, prescription pain medications won't be needed anymore, and surgery can often be avoided or postponed. You can be an active participant by sharing suggestions in the comments section about what topics you'd like for us to cover, or what information you are interested in learning. Your comments are a valuable space for offering constructive criticism or letting us know your thoughts on our video. If you found this video helpful, please click on the thumbs up button and click subscribe now to support us in sharing these insights to help more people fix their pain naturally using their own platelets. If you have a friend or family member experiencing pain, please share with them this video. That's the end of this video. Thanks for watching. We will see you in the next one. Peace.